Let's talk about autoimmune diseases such as eczema, psoriasis, rheumatoid arthritis, even diabetes type 1 will fall into this category. If you ask your primary care physician or rheumatologist, what's the cause of autoimmune condition? And the answer will be the cause is unknown, but it seems that for some reason your own or our own immune system get overstimulated. So as a result, the treatment should be suppression of your own immune system. And that's what also I learned in medical school. However, when I started to learn in naturopathic medical school about possible different causes of autoimmune conditions, I came across the term called Leaky Gut Syndrome. And it's a strange term. I'm not sure that I like it, but hey, it's a little bit tacky term. When I was reading a journal of gastroenterology many years ago, turns out that there was a term there called gastrointestinal tract mucosal permeability, or also intestinal permeability. And when I learned about it, I realized it's the same as leaky gut syndrome. So I keep learning, and so I just posted here a few articles that you may be interested to find do your own research on the topic. Like this one, for example, number 1, omeprazole-induced gastrointestinal tract permeability, and it came from PubMed, article number this one. And here, number 2 is about probiotic, how probiotic can help to deal with Escherichia coli induced intestinal permeability, and here is the article. Anyway, I want to explain you what the leaky gut syndrome, how it will create intestinal permeability, and I will do that. Let's go to the blackboard, and I will really try to simplify that for you. I already pre-draw here. You can see a picture of the digestive tract. So this is the mouth with the teeth. This is esophagus, stomach, small intestine here, large intestine here, and this is our bloodstream. So what happened? Digestive tract is lined by cells called enterocytes, and they are very nice and smooth, and they lie together very tightly to each other. There are no gaps between the cells. So no food can go between those cells from the digestive tract into our bloodstream. However, sometimes for different reasons, and I name here as the causes, that cells could be damaged. And what can damage those cells? Number 1 is bugs. Let's write here bugs. And I mean bacteria, viral, fungal infection can damage those enterocytes. Number 2, drugs. And we know many of the drugs like PPI, I just showed you, like omeprazole, proton pump inhibitors, antibiotics, non-steroid anti-inflammatory drugs, foods. Good example of food that will create a damage of the digestive tract is dairy product. Number 4 is chemicals. I will write chems. Chemicals stays for chemicals. What happened? The cells get damaged, and they are not as nice and flat, and the gaps get created between those cells. As a result, particles of undigested food, thick particles, can go through these gaps and will end up in the bloodstream. And here is the particle of the food. It does not belong here in the bloodstream, and in medicine it's called antigen. When there is antigen in the bloodstream, immune system will start to look at that and will create and will attack it and will create antibody. So antibody will surround this antigen, and this is called antigen-antibody complex. It does not belong in the bloodstream, and it will go into different organs and tissues. Let's say this antigen antibody complex will end up in the skin. If this is your skin, and here is the antigen antibody complex. It's a foreign substance here inside the skin. Immune system will identify that and will send a signal saying that, oh, something wrong with the skin. We need to attack, and it will attack actually your own skin, and it will create inflammation. I will write here, inflammation. Okay, this inflammation in the skin will be expressed as a eczema, psoriasis. If this antigen antibody complex get deposited in different tissues such as joints, it will be rheumatoid arthritis. If it get deposited in a pancreatic gland, it will be diabetes type 1. So this is simple explanation. I hope, guys, you will understand. So as a naturopathic physician, I have to look into autoimmune condition. What is actually cause of that? And one of the possible causes is increased digestive tract permeability. And here are for you a possible causes of increased digestive tract permeability. So if you want to get rid of autoimmune condition, you have to identify, do I have a leaky gut syndrome? Yes and no. And what causes it? Is it bug? Is it drug? Is it food? Is it chemicals? Eliminate those causes. Treat the lining of digestive tract, make cells healthy again, and you will become healthy. And that's Veronica Wax with crazy healthy ideas. What you can do to stay healthy, please ask me questions, and I'm here for you to answer all your questions.